A 72-year-old retired teacher named Margaret came to me after her second stroke. She'd done everything right. She'd been on blood pressure medication for 15 years. She'd switched to low-sodium everything. No table salt, no processed foods. She read every label. Her doctor had congratulated her at every appointment. And then one Tuesday morning, while reaching for a coffee mug, the left side of her body went numb. Here's what nobody told her. What I'm going to tell you today. The sodium you've been avoiding isn't the problem. The real danger is what happens when you remove it. My name is Dr. Michael Harrington. I'm a cardiothoracic surgeon with 32 years in the operating room. I've opened over 2,000 chests. I've held beating hearts in my hands. And I've spent 3 decades watching the same preventable pattern repeat. Patients who followed every guideline, avoided every grain of salt, and still ended up on my table with damaged hearts and failing kidneys. Today, I'm going to tell you what nobody took the time to explain to them. The truth about salt is not what you've been hearing for the last 40 years. After 60, your body stops being forgiving about electrolyte balance. Let me explain what that actually means. Think of your cardiovascular system like a garden hose system that's been running for 6 decades. The hose itself, your arteries, has lost some of its elasticity. The walls have stiffened. What used to stretch and accommodate pressure changes now responds more rigidly. The pressure regulator, your kidneys, doesn't respond as quickly as it used to. The sensors that detect sodium levels in your bloodstream become less sensitive. The hormones that tell your body to hold on to or release sodium take longer to activate and longer to shut off when they're no longer needed. And the fluid you're running through that system needs a very specific mineral composition to keep everything functioning. This is where everything changes after 60. Sodium is not your enemy. Sodium is the primary electrolyte that determines how much fluid stays in your bloodstream versus how much moves into your tissues. Your cells sit in a bath of fluid outside your blood vessels. That fluid is constantly exchanging water and minerals with your blood. Sodium is what keeps the right amount of water in the right place. When sodium drops too low, your blood volume drops. When blood volume drops, your heart has to work harder to push what's left through your system. Think about that. Less fluid means less pressure passively generated by volume. Your heart compensates by squeezing harder and beating faster. Your blood pressure doesn't go down. It goes up, and worse, your organs start failing from inadequate perfusion. Your brain gets slightly less blood flow. You feel foggy, dizzy when you stand. Your kidneys get less flow. They start to decline faster. Your muscles get less oxygen. You feel weaker without understanding why. Here's the statistic that should terrify anyone over 60 who's been told to avoid salt completely. More than half of adults over 65 who are on low-sodium diets are actually experiencing chronic low-grade dehydration without realizing it. They think the fatigue is aging. They think the dizziness is just part of getting older. Their doctors see high blood pressure at the appointment and prescribe more medication. Nobody checks their actual sodium levels. Nobody asks if they're thirsty all the time, or if their skin has lost its elasticity, or if they're urinating less than they used to. All signs of chronic low-grade dehydration. All fixable. All ignored because the assumption is that less sodium equals better health. For many people over 60, that assumption is killing them slowly. Now here's the first thing that's been destroying hearts for decades. The advice to avoid all salt. You've heard it so many times it feels like gospel truth. It's repeated in every health magazine, every doctor's office pamphlet, every hospital discharge instruction. Avoid salt, reduce sodium, go low sodium. But here's the counterintuitive fact. When you cut sodium too low, below about 1,500 milligrams per day for someone over 60, your body activates a survival system. It releases hormones that tell your kidneys to hold on to every molecule of sodium they can find. These hormones are called the renin-angiotensin-aldosterone system. In a younger body, this system calibrates precisely. After 60, it overreacts. Those stress hormones constrict your blood vessels. They increase inflammation. They raise your blood pressure more than the salt you avoided ever would have. I've seen patients whose blood pressure dropped 20 points when they added salt back to their diet, not removed it. Let me tell you about James. 78 years old, former engineer. He came to me with blood pressure that wouldn't respond to 4 different medications. We ran a full electrolyte panel, something most doctors skip because it's not part of the standard workup. His sodium was 129. Normal is 135 to 145. We didn't add medication. We added a 1/4 teaspoon of sea salt to his morning routine and told him to stop buying low-sodium everything. 6 weeks later, he was down to 2 medications. His blood pressure averaged 128/76. Write that down. Which of you right now are on a low-sodium diet and still struggling with high blood pressure? Tell me in the comments. The fix here costs nothing. Add a 1/4 teaspoon of unrefined sea salt to 16 ounces of water first thing every morning. Not table salt, sea salt, or Himalayan pink salt. The mineral content matters. Give it 4 weeks and check your numbers with your doctor. This next one surprises people every time. Processed foods labeled low sodium are more dangerous than regular processed foods. Stay with me. When manufacturers remove sodium from processed foods, they have to replace it with something to preserve shelf life and add flavor. They can't just take the salt out and sell you bland mush. Nobody would buy it. So they use potassium chloride. It tastes salty-ish. It preserves the food. And on paper, it looks healthier because the sodium content on the label drops dramatically. The problem is what that substitution does inside your body. Now, potassium is essential. You need it. Your heart needs it. Your muscles need it. But in the massive concentrated doses found in low-sodium processed foods, especially when you're eating multiple servings per day, it creates an electrolyte imbalance in the opposite direction. Too much potassium relative to sodium. And that imbalance makes your heart's electrical system unstable. I've seen more arrhythmias, irregular heartbeats, in seniors eating heavy amounts of low-sodium processed foods than I ever saw in people eating normal sodium levels. The mechanism is this. Your heart beats because of electrical signals that travel through specialized cells. Those signals depend on a precise ratio of sodium and potassium moving in and out of the cell membranes. Sodium rushes in, potassium rushes out. That exchange creates the electrical current that triggers each heartbeat. When that ratio shifts too far toward potassium, the signals misfire. The timing gets off. You get palpitations. You get atrial fibrillation. You get sudden cardiac events that look like they came from nowhere. But they didn't come from nowhere. They came from years of eating foods that were marketed as heart healthy when they were actually destabilizing the very organ they claimed to protect. A 69-year-old woman I operated on last year had been eating low-sodium frozen meals twice a day for 3 years. Breakfast burritos, dinner entrees, all labeled heart healthy, all loaded with potassium chloride. Her potassium was elevated at 5.6. Her sodium was low at 131. She developed AFib that wouldn't convert back to normal rhythm. We had to cardiovert her, shock her heart back into rhythm twice. Even after that, she needed medication to keep her heart stable. Her cardiologist had never asked about her diet. Nobody connected the frozen meals to the arrhythmia until we went through her food diary line by line. Has your doctor ever checked your potassium levels alongside your sodium? Most patients never have. If you're eating anything labeled low sodium more than twice a week, you need a comprehensive metabolic panel. Ask your doctor specifically. Write this down. Potassium to sodium ratio matters more than sodium alone. You need both in balance, not one high and one low. The fix is simple, but requires a shift. Stop buying anything labeled low sodium. Buy the regular version and control your portion size instead. Or better, cook your own food and add salt deliberately. Half a teaspoon per meal if you're cooking for 2. You'll know exactly what's going in. You'll avoid the potassium overload. That's all. 2 more items after this one. And item 4. That's the one that even I had a significant blind spot about for the first 15 years of my career. Stay with me. Here's where it gets complicated. The type of salt you use determines whether it helps or harms. Table salt, the white stuff in the blue cylinder with the girl and the umbrella, is sodium chloride stripped of every other mineral. It's been bleached. It's been refined down to 100% pure sodium chloride. And then they add iodine and anti-caking agents. Your body doesn't recognize it the same way it recognizes naturally occurring salt. When you consume refined table salt, especially in the amounts most people use when they do use salt, it doesn't come with the balancing minerals your body needs to process it effectively. No magnesium, no potassium, no calcium, no trace elements like zinc or selenium. So your kidneys have to pull those minerals from your bones and tissues to handle the sodium. They have to rob Peter to pay Paul. Over time, this creates a deficit. You end up with both high blood pressure and mineral depletion at the same time. It's a double hit that most people never connect back to the salt they're using. The age-specific amplification is this. After 60, your kidneys are already less efficient. They've lost about 30 to 40% of their filtering capacity compared to when you were 30. They can't compensate the way they used to. They can't pull minerals from storage as quickly. Refined salt becomes a genuine burden on a system that's already working at reduced capacity. But unrefined salt, sea salt, Himalayan pink salt, Celtic sea salt, contains 50 to 80 trace minerals. Magnesium, potassium, calcium, iron, zinc, all the elements your body recognizes from the ocean where life began. When you consume sodium in this form, your body has the cofactors it needs to regulate blood pressure naturally. The magnesium relaxes blood vessels. The potassium balances sodium. The calcium supports proper muscle contraction, including the contraction of your heart. It's not just sodium. It's a complete mineral package. I switched my own patients to unrefined salt more than a decade ago. The ones who made the switch and tracked their blood pressure saw an average drop of 12 points systolic within 3 months. Not from eating less salt, from eating better salt. Let me tell you about Eleanor, 81 years old, lifelong user of table salt. Blood pressure 152/90 despite 3 medications. We didn't change her medications. We didn't tell her to use less salt. We told her to throw out the table salt and buy a bag of Himalayan pink salt instead. She used the same amount she always had, maybe half a teaspoon per day. 8 weeks later, 134/78. Her nephrologist called me to ask what we'd done. I told him we gave her body the minerals it needed to regulate itself. Do you know what kind of salt is in your kitchen right now? Go check after this video. The question to ask at the store is simple. Does it say unrefined on the label? If it's pure white and flows like sand, it's refined. If it has color, pink, gray, off-white, and clumps slightly when you touch it, it's unrefined. Make the switch starting tonight. Let me ask you something before we go further. Have you ever been told to avoid salt entirely because of kidney disease? Most seniors with any kidney issue get this advice automatically, and it's backwards for the majority of them. Here's what actually happens. Your kidneys regulate sodium. When they start to decline, the standard advice is to remove sodium entirely so the kidneys don't have to work as hard. But here's the truth. Mild to moderate kidney disease, stages 1 through 3, actually benefits from adequate sodium intake because sodium maintains blood volume. Blood volume determines kidney perfusion. Perfusion is blood flow. When blood flow to the kidneys drops because you've restricted sodium and your blood volume is too low, the kidneys get less oxygen. Less oxygen means faster decline. You're trying to protect the kidneys and you're starving them instead. This applies to most seniors with elevated creatinine or reduced GFR who aren't on dialysis yet. I'm not talking about stage 4 or 5 kidney disease. I'm talking about the early stages that affect millions of people over 65. The mechanism is this. The kidneys filter your blood. They need pressure and volume to do that effectively. When sodium is too low, the volume drops. The pressure your kidneys feel, renal perfusion pressure, drops with it. The kidneys interpret this as dehydration. They activate the same stress hormones I mentioned earlier. Those hormones damage the kidneys over time. A 74-year-old man came to me with stage 2 kidney disease. His nephrologist had put him on a strict low-sodium diet, under 1,000 milligrams per day. His GFR was 58 and dropping every 6 months. We ran labs. His sodium was 127, dangerously low. We worked with his nephrologist to bring his sodium back up to the low end of normal. Not high, just normal. A teaspoon of unrefined salt per day, spread across meals. Within 4 months, his GFR stabilized at 61. It didn't reverse completely, but the decline stopped. Which of you have been told you have reduced kidney function? Have you been told to avoid salt completely? That's a question worth raising with your doctor. The specific fix depends on your labs. You cannot do this without medical supervision if you have diagnosed kidney disease. But the question to ask your doctor is this. Write this down. What is my actual serum sodium level right now? And is my current sodium restriction causing it to drop below 135? If the answer is yes, you need a different strategy. This one is the hardest to talk about because it involves admitting that the medical system you've trusted has been giving incomplete advice for decades. The low-salt guidelines that every major health organization has promoted since the 1970s were based on population averages, not individual physiology. They assumed that high sodium always equals high blood pressure. The research has never actually supported that for everyone. There are salt-sensitive people, about 25% of the population, whose blood pressure does spike with sodium. But for the other 75%, sodium intake has almost no effect on blood pressure. And for a subset of seniors, restricting sodium raises blood pressure instead of lowering it. The studies that showed this have been published for years. They just don't make it into the standard 15-minute appointment script. Your doctor isn't withholding information maliciously. The system rewards the prescription, not the follow-up. The system doesn't give them time to explain the nuance. After 60, your individual response to sodium matters more than the population guideline. Some people need more, some need less. Almost nobody needs the extreme restriction that's being recommended across the board. Here's the real-world example. A 66-year-old woman. Nurse, actually. She knew the guidelines. She followed them religiously. No added salt for 8 years. Her blood pressure was 148/92 on 2 medications. We tested her salt sensitivity. We had her track her blood pressure while eating normal sodium for 2 weeks, about 2,500 milligrams per day, then low sodium for 2 weeks, under 1,200. Her blood pressure on normal sodium averaged 132/80. On low sodium, 146/90. She was salt inverse. Restricting sodium raised her pressure. She's not rare. Studies show 15 to 20% of people over 60 have this response. Have you ever tested whether you're actually salt sensitive? Almost nobody has. The test is simple. It requires a home blood pressure monitor and 2 weeks of careful tracking. Eat normally for 1 week. Check your pressure twice a day. Then restrict sodium significantly for 1 week. Check again. If your numbers go up on restriction, you have your answer. The fix is to stop restricting and start monitoring instead. Aim for 2,500 to 3,000 milligrams per day from whole food sources and unrefined salt. Track your response. Your body will tell you what it needs. I want to be honest with you for a moment, not as a content creator, as a surgeon, as someone who has seen what happens when well-meaning advice goes unchecked for decades. I have stood at an operating table at 3 in the morning holding a heart that was struggling to generate enough pressure to perfuse the brain. I have spoken to families in waiting rooms at dawn, families who had no idea anything was wrong when they said goodnight 12 hours earlier. In case after case, the contributing factors were not mysterious. They were electrolyte imbalances, chronic dehydration, and well-meaning dietary restrictions that had been followed for years without anyone checking whether they were actually helping. These are not exotic risk factors. They are the background noise of millions of ordinary kitchens. Salt shakers thrown away. Low sodium labels trusted without question. Doctors congratulating patients for compliance without ever running a sodium level. And that background noise, accumulated meal after meal, year after year, creates the conditions for sudden catastrophic events that look like they came out of nowhere. I want to tell you about a patient. I'll call her Diane. 73, retired accountant, meticulous about her health. She came to me after a fall that resulted in a hip fracture. Not a cardiac case at first, but when we ran her pre-surgical labs, her sodium was 126. Her potassium was 5.4. Both dangerously out of range. She'd been on a low-sodium diet for 12 years. She ate low-sodium bread, low-sodium soup, low-sodium everything. She never added salt to anything. Her blood pressure was still 142/88. We delayed the surgery. We corrected her electrolytes first. We taught her how to eat normally again. 6 months later, she was off one of her blood pressure medications. Her pressure averaged 126/76. She walks 3 miles a day now without dizziness, something she hadn't been able to do in years. The first thing she said to me at her follow-up was this: "Why didn't anyone check this sooner? Why did I spend 12 years doing something that was making me worse?" That question stays with me. It's a big part of why I make videos like this one. Let me recap the 5 things I've covered. 1. Avoiding all salt activates stress hormones that raise blood pressure more than moderate salt intake ever would. 2. Low-sodium processed foods create dangerous potassium to sodium imbalances that destabilize your heart's rhythm. 3. The type of salt matters. Refined table salt depletes minerals. Unrefined sea salt provides the cofactors your body needs. 4. Most seniors with mild to moderate kidney disease benefit from adequate sodium, not restriction, because it maintains the blood flow their kidneys need to function. 5. The low-salt guidelines are based on population averages and don't account for individual responses. 15 to 20% of seniors actually see their blood pressure rise when they restrict sodium. Which of these items do you recognize in yourself? Tell me in the comments. I read every single one. There is someone in your life, a spouse, a sibling, a friend, who needs exactly this information. Someone who's been told to avoid salt and is still struggling with blood pressure or fatigue or dizziness. Send this to them. That one share might be the most important thing you do today. Every week I bring you honest, evidence-based information that I wish every one of my patients had access to long before they needed surgery. If you want more of that, subscribe. One last thing, and this is important. Everything I've shared today is based on published research and my clinical experience as a cardiothoracic surgeon. But your situation is unique. Your history is individual. Your history is individual. Before changing anything, any medication, any supplement, any routine, please talk to your own physician first. That conversation is not a formality. It is the whole point. Better information, better conversations, better outcomes. That's the chain that truly matters. Your heart has been working for you every single minute of every single day for 70, 80, 90 years without ever asking for anything in return. Give it this. Take care of your heart.